Um, this is it. This is our last presentation for 2023. It's really exciting. We're going to be hearing from 6 more state arts agencies who are going to tell us about their efforts to prioritize equitable access to the creative aging programs that they are delivering in their state. What does equitable access mean? That is a great question. And given the diversity of each state's population size and distribution, geographical considerations, the ethnic, racial, and linguistic makeup of communities in each state, and many other factors, this phrase truly means something different to everyone. There's a phrase that I've heard related to working with older adults that goes like this: if you've met one 80-year-old, you've met one 80-year-old. People's lives experience are so different in the aging population that we should presume more difference than commonality. And I think the same thing could be said about state arts agencies as well. There's such a diversity. Each state is so unique. And so each state takes a really different approach to equitably delivering creative aging services to their constituents. So we're going to hear from these 6 state arts agencies one at a time in a progressive conversation format. And then as usual, we're going to have about 10 minutes or so for audience Q&A. So there were so many amazing questions coming in our last session. Keep them coming, and the more detailed, the better. Full bios of our presenters are, as usual, in our speaker bio packet, which Tiffany is going to share. Thank you, Tiffany. And please welcome Ann Alston, Program Specialist, Nebraska Arts Council; Rebecca Cruse, Deputy Director, South Dakota Arts Council; Stephanie Haines, Arts Education and Accessibility Manager, from the Indiana Arts Commission; Kim Johnson, Director of Arts Access at the Tennessee Arts Commission; Christine Leahy, Program Director, Arts and Education, New York State Council on the Arts; and Sheila Dean Ross, Program Officer, Arts Education and Accessibility at the Delaware Division of the Arts. Stephanie and Sheila, you are our first progressive conversation pair. So we're going to spotlight you. And I'm going to bring up my timer and we're going to get going. Okay. Sorry, let me get my timer here. There we go. And there you go.
Thank you so much, Sheila. I'm so excited to chat with you today. I'll just tell everyone else who hasn't gotten to know you as well as I have. Sheila Dean Ross has been a leader in the Delaware State Arts Division for 27 years. And specifically in Arts Ed since 2006, she's the Arts Education and Accessibility Program Officer. I'm so excited to speak with you today, Sheila. Can you tell us a little bit about what the creative aging programming in Delaware looks like right now? You're muted. Sheila, you're muted.
I would be remiss if I didn't thank NASA and E.A. Michelson Philanthropies for the funding opportunity that allowed us to get this program off the ground, in addition to Lifetime Arts, who provided their expertise and training and developing our organizations and teaching artists to do this important work. So our creative aging program basically consists of pairing trained teaching artists who are on a creative aging teaching roster that we developed, and it pairs them with hosting organizations, libraries over the past 2 years, and this year, several senior centers. And organizations basically choose the arts discipline that they would like to feature, and then they select a teaching artist from our creative aging teaching roster to partner with. The teaching artist develops the curriculum. Together, the teaching artist and the organization work to create a budget and then decide on the best time frame to do the 8 weeks of sequential learning workshops with this culminating activity to share and show what everyone has done in the workshop and celebrate what's learned.
Great. So great to hear. Sounds like some really good partnerships you are supporting through your work. I'm wondering, from your vantage point as a state arts agency, what goals do you have for providing creative aging benefits to underserved communities in your states?
So initially, when we were selected to get the grant in spring of 2021, our initial goal was to choose a partner that could help us reach into the many different communities that call Delaware home. So location is essential in a state like ours where public transportation isn't plentiful, particularly in the rural areas. So partnering with libraries, of which we have 33 throughout the state, was key to our success. And in year 3 of our work, which we're beginning now, with creative aging, we have added several senior centers to our cadre of hosting organizations, purposefully selecting senior centers in locations where we didn't have library representation.
Very interesting.
Mhm.
Great. Are those senior centers, were they easy for you to connect with, or was it a lot of outreach and conversations?
Well, we had intentionally done a video after our pilot year, which pretty much sold the program. Once you hear a librarian, a teaching artist, and participants talk about the benefits, it pretty much sold themselves. But we did select senior centers purposely throughout the state. We were trying to fill in the holes. We looked at Delaware as this one big map, and we were just putting dots, like darts, on everywhere we were. And then with each progressing year, adding to places where we weren't, to be intentional about reaching our communities, particularly the ones that we weren't doing arts in.
Mm-hmm. I hear your focus on geographic access. How are you thinking about ensuring equitable access across all communities in your state? Is it primarily geographic? Do you have other lenses you're looking through?
Geographic was a big issue for Delaware because we are top heavy in that a lot of our urban center, our big city, is at the top of the state, with a lot of the rural communities and then the beach community towards the south of the state. So we were trying to figure out how we make it fair for everyone. And so back to the libraries, partnering with the Division of Libraries helped us tremendously in that regard because libraries are strategically placed throughout the state. And they already have a reputation as a community hub that attracts people. So that was kind of a win on our part. And we had previously done work with our libraries with putting arts in libraries for children. So going to the other end of the spectrum was sort of a natural move for us. So our state, like I said, is 3 counties and it's long. Main cities at the top, urban, and the things that come with urban. Our state capital's in the middle, and then a lot of our rural and beaches are to the south, with the beaches being on the southeastern part of the state. So the first pilot year, we had 8 libraries participate. 8 libraries took a chance on us. And from that year, they put out, good news travels fast. That's a very, very true statement. So the second year, we doubled that number to 16 libraries hosting workshop programs. This year, we're bringing on training an additional 13 libraries, plus we're adding 5 senior centers. So after the dust settles, we will have 34 hosting organization sites throughout the state. So out of our initial target of 33 libraries at the start of this journey 2 years ago, we will have 29 out of 33 libraries trained and able to host creative aging programs.
That's really exciting. Congratulations. One more question. I wanted to hear more about, at the beginning, you talked a lot about teaching artists and how they intersect with your programs. Can you go a little deeper into the role of teaching artists in your program?
I'll try with the limited amount of time that I have. I've told the teaching artists, I was like, you're the engine of this project train, and it doesn't move out of the station without you. So once again, we're grateful to Lifetime Arts because they're providing training for our teaching artists for them to better understand the needs of the older population. And the teaching artists are critical as they place a heavy emphasis on the fun, the socialization, the enjoyment with all of the programs. And so this year we will be training additional teaching artists, and we were again intentional in finding areas that we needed more artists so that we could hit some of the underserved areas of the region. And so everything isn't the big city. Fingers crossed.
Thanks, Sheila. I appreciate you sharing your good work with us.
Thank you so much. I look forward to the journey, the labor of love. I think it's my turn now. And I am going to introduce our next interviewee, Ann Alston. She is the program specialist for the Nebraska Arts Council. And in her role as program specialist for the Nebraska Arts Council, she works to ensure that all Nebraskans have opportunities for lifelong learning in the arts, including arts education in the schools and obviously creative aging program. Welcome, Ann.
Thank you, Sheila. Good to see you.
And could you share a little bit, give us an overview of what the creative aging program is looking like in your state as it develops?
You bet. It's not completely unlike yours because we involve libraries. We call our program in Nebraska Creative Aging Arts Program, or CAP for short. I need a good logo to go with that. And our program also involves trained teaching artists who do residencies in libraries, but also in arts nonprofits, local agencies on aging, basically any entity that's eligible for grants, and most of our other programs can also apply for our creative aging grants. Unlike Delaware, we have a really big state. We have a very large, related a lot to our Western states folks who were talking earlier. It's a big state with many rural expanses and a fairly limited population except for a few isolated urban areas. So it's an interesting challenge to reach the whole state. And so to that end, we are working to ensure that different regions of the state have artists who live in those regions. And we have created grants to appeal to some of our more non-traditional grant applicants. We've tried to streamline them to the extent possible, and they're non-matching grants. So that's a big inducement for many organizations to apply to us. I can go on, or I don't know if you want to go ahead with another question at this point.
Well, I understand that Nebraska's program, similar to Delaware, it also involves public libraries. So how does that compare or contrast to Delaware's programs?
Well, the interesting thing is this. So when we started a couple of years ago with the first grant through NASA and the E.A. Michelson Foundation, we made our program open to all kinds of entities. And we were really surprised and pleased to see a number of libraries apply to hire artists in residence. And that's a group that we had really not worked with very much before. And so these were first-time applicants, and they were specifically several very rural libraries. And the last 2 years have really been a learning time for us because we've tried to be responsive. When we saw this new enthusiasm coming from libraries, we decided to try to build upon that some. And so, although our grants are open to all kinds of different groups, we have established a much more solid relationship with the Nebraska Library Commission. I scheduled meetings, was happy that the state library commissioner was willing to meet with us. And my partner in crime here at Nebraska Arts Council, Joshua Brown, he and I have met with the library commission. We have done presentations for, they have a particular program that they do weekly online, where we did a presentation online for libraries, public libraries across the state. And we just recently completed administrative training for librarians through Lifetime Arts that I think went really, really well. And all of this was with the encouragement and endorsement from the commissioner, the library commissioner, as well as our regional library directors and many other librarians. So that's been one of the many things that we built upon. This new partnership has been an exciting part of the evolution of our program in our state.
Well, it sounds like libraries might start taking the lead in some of those applications for partnerships. But since your state is so large geographically, how are you thinking about equitable access to creative aging across all of your communities?
Yeah, realistically, because we have a state that has 93 counties, if you can imagine, we may not reach every corner of the state, but we're really, geographically speaking, we are really working to expand our reach. And most recently, so we're building our cohort of trained artists. And just like I heard Monica talking about this a good bit in the Western States presentation, we have this challenge of having a big state where we have many very small rural communities that don't have as many artists, or at least not artists that we've worked with before. So we're actively trying to engage more artists to go through the training with Lifetime Arts who come from different regions of the state. Likewise, we also have a couple of big urban centers, Omaha, the city of Lincoln, and we're ensuring that we have sufficient artists who live in those areas, because by and large, what we found is that unlike our traditional artist residency program, where artists go into a school or a nonprofit and spend a week or 2 or 3, and they're in one site, and they may travel to get there and stay there. With the creative aging arts program, usually it's once a week, most commonly once a week, or maybe twice a week. So we need to find artists for whom the travel is not such an issue, who live closer to the areas being served. So that's something that we're working on. I will also say that although we may not be able to sponsor a residency in every county in our state, at least not at this point, we are helping build awareness. That's another effort to be more equitable, to build awareness by working with the Library Commission, doing presentations, not only for libraries, but in other settings. We're helping to build awareness so that there, hopefully, there would be increased appreciation for creative arts initiatives, our aging initiatives, and entities, libraries, nonprofits, etc., may also take the ball and run and do some of their own programming. So those are some of the things we're doing to try and ensure equitable access.
Do you think that you'll be able to reach some of your underserved constituents?
Absolutely. Oh yeah, that's absolutely. By making our grants non-matching, it helps a lot. We're getting applications from groups that otherwise might not have applied. And we really work a lot. And I have to give kudos to Josh, because Joshua Brown does a lot of the work directly with the grant applicants and walks them through the process and encourages them, the first-time grantees, groups that haven't historically applied for grants from the Arts Council. So yeah, so I'm excited about where it's going. I see our timer is about to run up. I'm afraid to keep talking.
I look so forward to hearing about more. I know we could go on and on and on, but thank you so much, Anne, for sharing.
Thank you, Sheila. It's good to see you.
Okay.
Hello, Rebecca. So it's my distinct pleasure to say hello to Rebecca and introduce Rebecca Cruse, who's the Deputy Director at the South Dakota Arts Council, where she does practically everything, I think. You coordinate arts education, community development, special programs, particularly in relationship to DEI and A initiatives, communications, legislative relations. Shall I go on? Anyway, hi, Rebecca. It's good to see you again. And yeah, so yeah, I'm curious to hear a little bit about what you've got going on north of the border, north of the Nebraska border in South Dakota, in your creative aging program. Can you provide like just a general overview?
Absolutely. Thank you, Anne. So in South Dakota, we have 2 dedicated programs for creative aging, and then a couple of supplementary programs that serve a lot of older adults as well. So our focus programs are Art for Life, which is a program we adopted and adapted from the North Dakota Council on the Arts. It's really wonderful, in-depth work in mostly traditional arts and also fine arts. The Art for Life program, and quick shout out to Josh Chrysler, who was presenting in the last session, because he really got the pilot for this program running in South Dakota when he was contracting with us, and did a great job with it. So what Art for Life does is it brings local arts agencies and elder care facilities into partnership with us, along with folk and contemporary artists. And the focus is to improve health and wellness of elders through intensive art and artist interactions. So currently we have programming in 7 communities, which we selected and worked with their local arts agencies to develop their capacity and get these programs running. They're strategically spread across our state. And Art for Life encourages, through Art for Life, we try to work to encourage communities to really think about their unique artistic and cultural resources, and then leverage them to positively address the health and wellness of elders in their communities. Some of the programs are in elder care facilities, others are in senior centers, some are in arts centers. So this program really puts a strong emphasis on traditional arts as well as the cultural background and experiences of the working artist. We also have a Teaching Artists Creative Aging Project grant, which is a non-matching grant. These artists do not have to be part of our roster programs. They do have to be qualified and trained in creative aging work. So they could have attended conferences to do that, or done lifetime arts training, or they can do a self-guided online program, which is the lifetime arts training as well. So artists can propose their own projects for that and receive up to $5,000 to carry out those programs in their own community or nearby communities. And then we also do have a teaching artist roster and a touring artist roster. These programs do serve a lot of older adults in our state, particularly our teaching artist residencies do that. We fund many nonprofit organizations that are serving older adults. One example would be Sanford Cancer Center. We fund about 40 weeks of residencies in that healthcare center in Sioux Falls. And that program is really, really wonderful. We get so much great feedback on that, but you know, it's providing great opportunity for both the artists and the people who are receiving cancer treatment there. They're not all 55 and better population. Some are children, some are you know, in between ages, but primarily I would say that serves older adults.
Interesting. Oh, that's fascinating. That's a lot of residencies in one hospital.
It is. They're very dedicated organization. It's actually Sanford Arts. They have an arts nonprofit as part of their hospital system. But it mostly serves the Cancer Institute there.
Oh, that's fascinating. Well, as you're talking about teaching artists, how do you view the role of your teaching artists in your effort to provide equitable access to the creative aging programs that you offer?
Yeah, so this is really important in South Dakota because, like you said when you were introducing me, at the state agency, we only have 4 employees. We only have 4 on our staff. So we're all doing a lot of things. We're all doing programming. We're all doing grant paperwork. We're all answering phones and all of those types of busy things. So what we have really realized through this work is that we have to just have absolute trust in our teaching artists. And we do that. We really try to, you know, we have faith in them. We know that the teaching artists we're working with are highly professional. They're highly skilled. They're very passionate about their work in creative aging. And they know their own talents and their own limits, and they know their own communities. So all of the teaching artists we work with, we just know that they're fully committed to serving and achieving in the same ways that we are. We have the same goals. So we commit ourselves to guide but not dictate their work, to support their needs, and then also to celebrate their success. We think that's a really important component of keeping teaching artists engaged and happy in this work.
I appreciate that. Yeah, you have to have artists that you can trust. And I'm trying not to look at the chat while we talk, but I see questions coming up about opening it up more broadly to artists. And anyway, it's an interesting concept of who you know and who you trust that you can work with. So one more question. In considering how older adults in your state are best served with the limited resources available through your agency, are you guided by the idea that the resources are best invested broadly across the state or more targeted to specific communities for dedicated purposes?
So in South Dakota, we're really taking a both and approach for this question. We have our really targeted approach with the Art for Life program, where we've selected the communities and helped develop those partners. We do that because we really value the traditional arts and arts learning rooted in tradition and place. We believe and have witnessed, we really recognize the accessibility and inclusive nature of sharing traditions and stories. And we've seen that even participants who generally stand back or who aren't able to fully participate in programming will find real connectivity and access points through that type of sharing of traditions and stories. So that is our, our sort of really focused group. But then with our teaching artist programs, that's where we're really able to provide broader access. Teaching artists, so whether they're on our roster and doing the residency program, or they don't have to be rostered to be part of our teaching artist creative aging program grants, those they just have to do the trainings. So that one, artists are working, in their own communities. They can be anywhere in the state. They don't have to be in one of our really connected communities. A lot of artists are working in prisons and reservations with immigrant or refugee populations who might be harder for a government agency to connect with. So that's how we've really looked at sort of dividing up our funding to be useful in a variety of ways. We really feel like our agency is most effective as a support structure for all of these talented and committed artists and art service organizations. who just really care about their own communities and can come to us and say, I know what I can do here. Can you give us funding for it? And we want to be able to say yes and support their needs and be flexible with our parameters so that it works for everyone in their own settings.
Excellent. Oh, perfect timing. Thank you.
Well, thank you very much, Anne. I appreciate your consideration of those questions. I'm going to be talking with Kim Johnson with the Tennessee Arts Commission. Welcome, Kim.
Hey, Rebecca, how are you?
I'm great. How are you?
Good, doing very well, very well.
Wonderful. Well, Kim is the Director of Arts Access at the Tennessee Arts Commission. And Kim's position includes ensuring access to the arts for underserved communities, especially for ethnic communities, older adults, people with disabilities, and military veterans.
Mhm.
And so Kim and I are going to do a deep dive here on their creative aging work in Tennessee. And Kim, could you start by please giving us an overview of the work that you're doing there with your agency?
Absolutely. Wow, the Tennessee Arts Commission has really been on, I think, a journey over the last few years. We actually started our statewide work in terms of creative aging about 7 years ago, actually. And people often ask me, said, how did you all get started and why did you get started? And I think it's very, why did we get started? There's a growing older adult population in Tennessee. We knew the power of the arts and what it can do for older adults, as well as I think it's important to mention that we had some significant partners who shared in our vision, and we all came to the table together. And that's why we got started. And so over the last 7 years, we've done 4 initiatives. Can you believe it? Some have overlapped, but we've done 4 initiatives, and I'll go through each one of them very briefly because it's important to see how things have built on each other to get where we are today with our work. The first one about 7 years ago was called Creative Aging Tennessee 1. And this initiative really funded those very small rural counties in Tennessee. We're largely rural. You have a couple of big cities like Nashville, Memphis, and so on, but we're largely rural. And so the success of that program of reaching those small rural communities was really gave us, I think, a satisfying taste of what could be done with older adults in the community. But I'll also say the success of Creative Aging Tennessee 1 was all about bringing on the partners, which were the Tennessee Department of Health and the Tennessee Commission on Aging and Disability, because throughout the last 7 years, they've been our hard partners throughout all the work that we've done. So they came on board and we did things like regional listening councils throughout Tennessee so that people could, in community, we could hear about what were the issues and the problems and what they wanted. So we listened well. Then became the Tennessee Person-Centered Music Program. Can you believe it? The Tennessee Arts Commission was awarded $1 million through the Centers for Medicare and Medicaid Services. It was a 4.5-year project when we went into nursing homes with residents and provided individualized music for those residents. I won't even begin to tell you, go on our website, learn more, but it created a significant impact for nursing home staff and residents here in Tennessee. And we were just really proud of that work. The third initiative is where NASA and E.A. Michelson Philanthropies came in, and we were so grateful, for that, because there was so much more that we needed to do. And so with that one in particular, we also funded programs and reached a lot of people. But we really concentrated on our artist roster at that point. We knew we needed to increase capacity of artists to work with older adults. And so as a result, we created our Creative Aging Teaching roster. And now we're into Creative Aging Tennessee 3. And I'm going to use these words. We are strategically and intentionally going into more small rural communities throughout Tennessee, as well as culturally diverse communities in Tennessee. So I'll stop there so we can go to the next question.
That's great. Thank you, Kim. I definitely am going to go to your website and learn more about your music-centered program. That sounds really amazing. I'm wondering, from your vantage point as a staff member at the State Arts Agency, what goals do you have for providing creative aging programs for the benefit of underserved communities in your state?
Yeah, I think Creative Aging Tennessee 3 is really, I'll focus on that because, like I said, strategically and intentionally going into rural communities and culturally specific communities. Tennessee has rich diversity. And so with this initiative, yes, we're also funding, but we're funding strategically in these communities because we saw a need to really get into these communities. And so when I say intentional, what we're doing is we're actually working with our folk life department and just working with our staff is working with existing relationships to go into organizations like the Bengali Association, the Chinese Arts Association. We have a large Kurdish community, and we're having conversations with them. And saying, hey, who are your artists? We want them trained. We want them to be a part of what's offered to older adults in community. So that's one way that we're really putting our efforts with this initiative into making sure that we're serving underserved communities through this Creative Aging statewide initiative.
So you mentioned a lot of important partnerships through all of these programs. Can you talk a little bit more about how critical those partnerships have been to your work in creative aging?
When we first came to the table with Creative Aging Tennessee 1, I remember the meeting well. It was Tennessee Arts Commission, the Tennessee Department of Health, and the Tennessee Commission on Aging and Disability. And I'll be honest with you, I thought, oh, this is going to be, a harder meeting. And they came to the table from the beginning, say, hey, we get this. We know the power of the arts. We know that we can help with you all change some of the outcomes, whatever those outcomes may be, of older adults in terms of reducing social isolation, in terms of improving physical health. But along the way, these partners also, let me tell you this, financially came to the table, as well as they provided staff resources and leadership to each of these projects that we have done. Even with the Tennessee Person-Centered Music Program, we included more creative leaders. You've got to get this individualized music to nursing home residents. And so we partnered with a very young urban kind of group to help us provide that music. So we had to think outside of the box, really, on looking at partnerships and those kinds of things. And like I said, with Creative Aging Tennessee 3 in particular, working with our folk life department, drawing on what the people they already know and the relationships that not only folk life, but that our staff, has built has been just critical. And then also, taking the time with these partners to really, sometimes, you send an email, but really making the phone call, sometimes visiting, with folks, having the conversation, I think has been a critical component. And when I say that I can already see the results that we're reaching with Creative Aging Tennessee 3. We've already started our grants funding with that particular initiative. And just the other day, we approved a grant, and I went to their website. And it kind of brought tears to my eyes because we were looking at such a small senior center that had no resources. They were in like this little bitty building on an almost empty storefront. But but they were excited about this opportunity. They're excited about providing an artist to go through lifetime arts training. And these are the people that we want to reach in, the organizations and the communities and the people that we want to reach in Tennessee with our initiatives.
That's great. Thank you so much, Kim. I appreciate you sharing.
Okay, we've got Christine. Hi, Christine. How are you today?
Hi, Kim. I'm great.
Great. Christine is the Arts Program Director at the New York State Council in the Arts, and she's in charge of arts education and literature there. And they have a wonderful program in terms of working with older adults. And the name of that program is New York's Creative Aging Leaders Network. All right, Christine, that's a long name, but tell us about that project and what you all have been doing in New York.
Well, we're on a similar timeline to you in Tennessee, and that our work focusing on creative aging is about 7 years old, and this is the latest iteration. The spark about 7 years ago was really that we were seeing more applicants coming in to seek arts education support to support their creative aging work. So we noticed that trend. And then one of those applicants was partnering with our colleagues in Pennsylvania. They're a state arts agency. And so I learned through our colleague Jamie about the training that they were doing in partnership with their Office for the Aging. And so that sparked an initial pilot program where we partnered with the area agency on aging in the area of Rochester, did some training and pairing, and everyone was really enthusiastic, both teaching artists and arts organizations, about that program, parlayed that into a statewide partnership with now involving our wonderful partner and partner, many of you, Lifetime Arts, and the statewide Office for the Aging, to bring a similar program of training and seed funding and support and implementation across the state. And then have been super fortunate to receive now 2 grants from NASA and E.A. Michelson to continue that work. And the last 2 phases have created a cohort of arts organizations and aging serving organizations that have ties to historically underrepresented communities. So in this phase, all of these organizations are already experienced with some creative aging and are going to receive funding and technical assistance to build that muscle, as well as have cohort learning opportunities facilitated by Lifetime Arts. And some of that will focus on documentation. And then at the end, as we did at the end of the last phase, there will be a convening, and this time we're going to invite more potentially interested folks to that convening so that the learning and the impact can be widened.
Okay, that sounds like an exciting program. My goodness, I love it. You were mentioning underrepresented populations, but how are you all ensuring equitable access to creative aging across all the communities in your state?
So for us, this program is an opportunity to underscore our agency priority. We kind of highlighted this priority with new language during the time of the pandemic. So we define historically underrepresented communities as those defined by race, ethnicity, geography, LGBTQ status, veteran status, and some other things. And so we purposely chose a cohort of organizations that are kind of by, for, and about such communities across the state. So not only is there direct service to their audiences and communities, but through the partnership with Lifetime Arts, they're getting continued professional learning. And then it's a two-way street because we're learning from them as well. We're hearing about what their challenges are, what their successes are. And so we as an agency are learning how to better support that priority of supporting these communities.
Gotcha. Well, you know, many of us have limited resources. And do you feel like you're guided by the idea that resources are best invested broadly across the state or more targeted to specific communities for dedicated purposes?
My answer is similar to Rebecca's in that, like many of us, you know, scale is a challenge in New York. We have some big urban areas and we also have some rural areas where there's sparse population that's spread out, like in the Adirondacks in the northern part of our state. And so with our focus, you know, we're not going to reach, you know, with direct service, like a large percentage of the state's older adults. However, these organizations learning from each other, creating case studies, and then presenting at a convening at the end of this project period is going to widen that impact. And that's the piece that we hope will live on. We hope that convening is one of the pillars of our strategic plan. It's something that folks in our field say that they want, and it's something that we have the capacity to support, usually with partners like Lifetime Arts. And so we do hope that that network and facilitation of conversation can continue beyond the life of this project.
Well, you mentioned documentation just a little earlier. And so tell us about what role will documentation play in New York's project?
So we decided that this would be an interesting thing for a Lifetime to help the organizations in the cohort focus on this time, because it wasn't a focus last time, but some of the organizations themselves had done some really wonderful documentation. For example, the Adirondack Center for Writing had partnered with a local correctional facility. And it's a facility where they had worked a lot before, but because of COVID, there was an older adults, quarters within the facility now. They found that it went really differently than a lot of their other writing workshops. The themes that were emerging were just different and really interesting and having to do with legacy. And so they actually created an anthology of the participants' work, which was just gorgeous to read. And it helped just spread the word about their program, and was interesting not only to the folks, in their region that they serve in kind of communicating like all the programs that they do to their audience. But then, we've also shared it. And so it's something that will live on. There were other examples that were interesting too, like an organization from that same region, Traditional Arts of Upstate New York. The art form they concentrated on was barn quilts. And as a city dweller, I had no idea what that was till I saw the images. And then on the other side of the state, in Buffalo, an organization called Squeaky Wheel was working with the community on the east side of Buffalo, which is largely African American, and had recently been impacted by a tragic shooting in a supermarket. And the elders that they were working with were really affected by that event, and were working through video to document that kind of moment in their lives and their community. So all these examples just got our wheels turning about, these projects are capturing like interesting moments in time, interesting like cultural artifacts, interesting things about the process of creative aging. And there's value in that. And so at this point, it's kind of like seeing as far as our headlights, like these documentations can be useful for the organizations, for the participants, but also like as a collective record of the work that we're doing. We think it just has a lot of potential. So we're very, excited to see where we'll go with it. It'll certainly help in that convening where people get to show off their work. But it's an area where like we can connect, like along the lines of the last session, we're all doing this interesting work in other states. And I know Sheila's got the great video from Delaware. That's been a point of inspiration for many. So yeah, let's see what we can do with this cool stuff that's coming out of these workshops.
Oh, thank you, Christine. Thank you for sharing with us the wonderful work that's going on in New York with creative aging. Thanks so much.
Thank you. And now I have the pleasure of introducing Stephanie Haines, who is the Arts Education and Accessibility Manager at the Indiana Arts Commission. So Stephanie, why don't you kick off our conversation with just a quick overview of your work in creative aging?
Great. In Indiana, our creative aging work is about 3 years old. We kicked it off with a focus on the teaching artists specifically. So we already had some artist training programs that were highly successful. And so we used those models where we pair training with funding opportunities so people can put the work they're learning about into practice right away. We use that model with our creative aging as well. So we trained 25 artists in the first year, and we have trained about 50 artists in the second year, for a total of about 75 artists in our state, trained and practiced in their creative aging approach and ready to kind of get out into the communities. Likewise, we knew that we couldn't just develop the teaching artists without also developing the field, being prepared to hire them and bring them into the facilities. So right away after we trained our first cohort of teaching artists, we invested in outreach to aging service providers. So community centers that serve older adults, libraries, and senior centers, AAAs, and congregate meal sites through the AAAs, all kinds of community sites. And we have been doing for the past year and a half training and funding for those organizations to start to understand how to find artists, connect with those artists, and partner with them in their communities. And finally, this year we are kicking off a new branch of this. I find them all interconnected, kind of a trifecta work, where we're funding and training with arts organizations, some of which have been dabbling in creative aging, some of which haven't, but those that are poised to do this work in a sustainable way, and we think will be good hubs for future teaching artist connections and mentoring to other arts organizations throughout the state.
Great, thank you. So you clearly have a lot of in-depth work with teaching artists, and you've laid that out really nicely. Do you want to expound a little bit more about their role in your program, how, what you're hearing from them has then come back to inform the development of the activities? Say more about your work with teaching artists.
Yeah, I've been thinking a lot about this, and the overarching question of the Institute of Equitable Access. And I think one of the things that we did early on in the work is not just put out a call, teaching artists, if you want to be funded in this program, apply to us. But we thought ahead and said, okay, if we want a diverse cohort of artists and we want them to do new work, creative aging, which in our state wasn't well defined or explored throughout the state, we decided we needed to go out and first do some info sessions. So even though it was during COVID, we did these online info sessions hosted by different partners around the states in rural communities, people who are connected in kind of what I would say unlikely places around the state for the work we do at the Arts Commission. And by hosting those and having them invite their community of artists that were local to them, we started talking about, this is what creative aging is, this is why we think artists should get involved. And from that early work, spreading the word and inviting more people in through their own kind of organic network, we got some of the most diverse group of artists applying for our program right away. So from that, we had some great geographic diversity, great racial diversity. We were really intentional on those priorities from the beginning. And I love this fact. We had over a third of all applicants who were over 60 years old themselves in our teaching artist applications. And compared to our other teaching artist work, which is often for emerging artists, some of our training programs, like get trained to do this work, further in your career. This was people who, from working with them now, kind of saw themselves in the creative aging work, and we were able to employ more peer-to-peer, work when the teaching artist is delivering to older adults, is an older adult, and there's some real authentic and great work that gets done that way. So I really love the work we're doing with teaching artists in the way we empower them to go to their own community. So we had priority on getting artists from all over the state, so that when we said, just go into your community and find a site, then that meant that we had sites that were extremely diverse, because we had priority on having a diverse geographic representation. And by having diverse racial representation and identity representation, even in Indianapolis, our metro center, you know, some people were from, you know, a Black community who went into a Black church and had diverse experiences with those community members that they were connected with, where other people were in their own communities, even within the same city. So by focusing on the priority of diverse teaching artist cohort and doing the pre-work, we were able to have more equitable access.
Great. Sounds like a lot of synergy. Can you talk a little bit about more about the particulars of your strategy for equitable access in your unique state context? And maybe a little bit more about key partners on delivering for this strategy and your own role in making those connections.
Yeah, thanks so much. We have some great partners at the Division of Aging. That is one of our key partners. And so they are partnering with us on outreach to their regions. They have a different regional system. We have a great partnership with our traditional arts and folk life group, which other people have mentioned, but that is one of the folks who helps train our artists as well, because our folk art, our folk life director has a lot of expertise in this particular area. So we were lucky to have that. So through this traditional arts network, through the Division of Aging that we partnered with, their regional partners, congregate meal sites, we're able to spread the work out in non-traditional areas. Some of this creative aging work, when we overlay maps of our grants at the Indiana Arts Commission, our arts organization maps, every year there's certain counties we struggle in. You know, every state I know has those counties. They go, oh, it's that county. Of course, we try so hard to reach every county. And when we overlay the map of grants for creative aging, we fill in those gaps. The creative aging programs where we can go to senior centers in small counties which don't have arts organizations, where the library, as other people said, or the senior center is some of the few kind of institutions people can gather at. This program is filling in the gaps of reach that we haven't been able to do with our traditional arts organization models. So equitable access is kind of at the core of this. In all of our guidelines, we state our priorities that we're looking for fantastic artists, we're looking for people that can be trained, and we're looking for people that represent unique locations and identities to make a well-rounded cohort and make sure we are reaching a lot of citizens in our state in a lot of different areas.
Great.
Thank you, Christine.
Thank you so much.
Yeah. Susan, we did it. Around the country in 8 states. We should have had a catchy title like that.
Wow, I have to say you all have set a new bar of excellence, and that is saying a lot, because I know each and every one of you to be excellent in your work and programming and effort. So well done, well done. I feel like, in fairness, I should have the timer on for our audience Q&A session as well, but maybe we've seen enough of the timer for now. So really beautiful to hear the threads that connect you all, and also so much difference among what your current work is. We do have a couple questions coming in from the audience, and I want to encourage everyone also to just keep them coming in as we chat here right now. I note that one of the questions that came in was about like the strategies of diversity, equity, and inclusion, which I think in general have been covered really well. But there's something that really sticks with me to just expand upon that audience member's question. Kim, you mentioned that the way that your agency is intentionally thinking about this question is by capitalizing on and leveraging relationships that, for example, your staff colleagues already have in folk and traditional and other things. And in other, like we heard Laura in our previous session talk about how sometimes state arts agencies are in a position where we're leaning into relationships that we have had for a long time, and it's hard to get beyond the relationships that we already have. And that keeps us in the cycle of not being able to reach diverse communities or communities that we haven't connected with. So I wonder if folks can just share a thought or two about that all-important work of not just building the relationship, but also sustaining the relationship. Because so often I have heard stories from you all about how important it is that trust is at the center of relationships with constituents, and the need to, quote unquote, serve communities and connect with communities might feel a little bit different from the other side of being contacted by a state arts agency, feeling like, what is this really all about? So thoughts about building relationships, but sustaining them also with trust and integrity. What do you all think?
Well, I guess I can start answering that for us. I think you're absolutely right, Susan, that trust for us has been built, first of all, with many of our culturally specific organizations in particular over the years. We've had great staff who have, taken the time to build relationships, who have traveled, that's important to say, across the state to meet with people in person when we could, it's about, I think it's also, to be honest with you, about the small things to build the trust of communities. It's, returning phone calls in a timely way to people. I'm just being totally honest. It's about having the patience to provide excellent technical assistance when people are struggling with an application, for example. I can see that just those those little ways of that, and people also that, like I think Sheila said, this is part of our heart and soul. Okay. And I think it comes across for a lot of people. And so when we communicate in that positive way, I think it comes back to us in a positive way. So those are just some, and I'll stop there.
Thank you.
Like Kim said, we could go on and on and on, but I consider all of the organizations that I've contacted and worked with, I consider them my babies in a sense. But I have done, and I will tell you, I have worked nights, some weekends, but I have worked through budgets. I had one library said, I don't do art speak. I need help. I'm a librarian. I said, okay, let's look at let's start from the beginning. Let's pick out an artist. And she's like, could you help me? Sure. And so I've literally been hands-on with each of these organizations. I've gone to their culminating events. I've talked to the people that are taking the programs, and they're begging me for more, to the point where at one, I said, the lady must have repeated herself 3 times. I said, ma'am, I promise you, I hear you. I hear you. We want to be intentional about going into communities. And I say this specifically because a lot of people think diversity means, people of color. But for us, diversity also means rural. And so I've called them and said, I don't want to assume what's important to you. And then they tell me, I go, okay, well, we'll design something that's right for you. And so just thinking about people where they are, but I think more importantly, asking them what they think before creating a program.
Beautiful. Other colleagues?
I kind of just touched on this with our teaching artist work. I think we're intentional in saying you don't have to work in a nonprofit setting for this. The teaching artist was funded, and we said, go where you want to go where the community near you is. So when I said, someone felt comfortable going to their church and reaching out to their elders, these programs were in churches, they were in malls, they were in parks departments, where people are gathering. So echoing what Sheila said, giving people permission to be where they are, where they're comfortable in their own communities, and being flexible about those sites was one way. We felt like the artist was able to have trust with their own community, and I wasn't out there trying to approach a church in a Black community saying, oh, you should do this thing. I was able to just empower an artist to do what was best for them. And that way the trust was already there.
Thank you for these thoughts. They're really so much learning that we do together. So I really appreciate that. Here's a different question that I really appreciated too. This is about teaching artists and training them. I think so often when we think about serving underserved communities in creative aging, maybe we're talking about the population that of older adults who receive the services. But teaching artists, as we've heard today, are definitely part of the equation as well. This question, are the trainers in the training programs for teaching artists, are they artists, educators, health professionals, gerontologists? What are their qualifications to train artists who are already trained and practicing in their craft? So how are we ensuring equity in terms of the experts, so to speak, that we're bringing in to train highly trained teaching artists? I know I'm looking through our audience too, that I believe we've got some colleagues from Lifetime Arts, and I know many of you have worked with Lifetime Arts, especially in this area to provide training for teaching artists. So our colleagues there definitely came to mind.
I'll say
yeah,
that, as I mentioned, we do happen to have someone in our community that has done research, is maybe more on the academic side, but then does traditional arts as well. So has this kind of dual role at the university and in community with artists. That made him a really good candidate to train artists on best practices of working with older adults. As anyone who's worked with Lifetime Arts knows, there's some unique approaches to working with older adults in learning settings that create the best results for everyone involved. So we had a local university-based expert. We also had an organization that was doing some training whose sole mission has been for like 50 years to work with older adults with musicians, like pair musicians with sites with older adults. So we use them to really talk about local connections and how to be a good partner. And then finally, after we had our first year of teaching artists through the training program, they did their pilot program and were on to their second round of funding, expanding their programming. We turned them into mentors. We had a mentor coaching program for our second year cohort of teaching artists who were kind of quote unquote new into creative aging. We had them all sign up for coaching sessions one-on-one with mentors who had just done the creative aging the 2 years before. So peer mentoring, and as much as possible, is always, I think, a best practice.
Thank you for that. Two other just points about accessibility that have come in the audience chat that are really interesting too, about accessibility in terms of reaching an online communities or reaching out virtually. How does that opportunity factor into your program design? And also language. Does anyone have a thought about, have you supported successful programs in other languages aside from English?
I can jump in here because I said, I think further down in the chat that we have supported a couple of programs. Actually, one of the first programs that I think I mentioned in Rochester area was with a senior center that serves a Spanish-speaking audience. And so we paired.
Oh no, Christine, come back. She froze on my end, right in the middle of a brilliant thought. There, you're back.
Okay, sorry, I didn't even realize I was frozen. So yeah, that was one of the first partnership programs that we supported, was with a senior center in the Rochester area, serving Spanish speakers and a Spanish-speaking teaching artist. It was actually covered by local media when they had their culminating event, which was around theater and storytelling, and in a couple other examples as well. And I think the keys are, if that's your aim, or if you're partnering with an entity that serves speakers of other languages, like they probably have the ties in their community with, an artist. And it's about, bringing in the right partners, as we've said over and over. And it's a wonderful way to expand, you know, the access and service, and like that media coverage was really a wonderful opportunity. We even have supported, I mentioned, I think in our prep call, there was one site visit that we did where a teaching artist was actually trilingual and teaching a Chinese ribbon dancing class in Cantonese, Mandarin, and English, and able to, you know, communicate with a very diverse set of speakers. So it's absolutely possible. I would love to connect with that person later if we want to compare notes.
Great. Any thoughts about the virtual online space and what that means for accessibility for you?
Yeah, Susan, I can talk about how we utilize online in South Dakota. We don't often have programming for arts learners online. We've found that that's not as useful for most of our elders in South Dakota, but we do want to make sure that that's very accessible for teaching artists who want to go through trainings. We encourage people, if they haven't participated in an in-person training, we've hosted the Lifetime Arts one, and then we also have we've done several Art for Life trainings in South Dakota. But if they haven't had the opportunity to participate in an in-person training, we send them to the National Guild for Community Arts Education. They can use their grant funds to purchase their membership, and that has a wealth of resources. It has all of the Lifetime Arts trainings, plus many, many other creative aging resources on that site. So if they haven't had the opportunity yet, that's how we encourage them to go through their self-guided training.
I so appreciate that, Rebecca, because that's one of those little nuggets about how you've designed your program, that the grant funding can be spent on that resource. That is such a hot tip for other state arts agencies that might be tuning in right now. So thank you. And thank you all. We are really close to the end, not only of our session, but the whole Creative Aging Institute. And I want to just make mention that one whole area that we didn't touch on too much, but has come up before, is the area of accessibility in terms of disability as well as aging. And there's a very important crossover and overlap there that I know all of you could speak to. But that's a good reminder for maybe Creative Aging Institute 2024, a good place to start. You all, thank you. As always, your expertise and willingness to share is so inspirational. So I just appreciate it so much and wish you all the very best.